So first of all, I'd like to introduce our first speaker, Elizabeth Perez. She is VP of Marketing and Communications for Harris County Public Health. She's going to share a little bit about the challenges and successes of educating the public, first about COVID, and then now we have the vaccine rollout. So there's been a lot of information that they've had to put out in a short amount of time. Elizabeth, thank you for joining us.
Thank you, Christine, and thank you for inviting me for this important topic and with this wonderful panel. So I'm going to briefly just go over a little bit about myself and kind of what public health is and what our role is around the pandemic. I come from a healthcare setting. I used to work at a hospital for several years, and one of the things that I learned was very early on, healthcare is very fragmented and very difficult, but it actually is a great opportunity to learn about communication, especially when people are at their most vital and critical points of their lifespan. So I have, with that in mind, I started going into very naively into public health, thinking that I could solve the healthcare problems in this country, and I had the answers. And then I realized that it was beyond what is really capable of just one person. Our health department, public health is a little bit different than what you see in a healthcare setting. Our job is to try to help the health and well-being of everybody in the community. So where you go into a clinic and you have one-on-one care, our job is to kind of be the physician and the doctor of the widespread community. So for Harris County, that's 4.7 million people. So we believe that there are so many things that indirectly and directly impact healthcare. So for instance, we look at economic opportunities. How does that impact people's ability to have health insurance? What do their neighborhoods look like? Are they have access to walkable sidewalks? What does nutrition look like? And so there's a lot of different programs that we have to address that. And so we look at it through just programmatic level and a policy. So in this pandemic, public health has been at the forefront of, because our job is to protect the health and well-being of the overall community. And before this, our job was to do that through a lot of wide variety of communicable diseases. So for instance, you have HIV outbreaks, you have tuberculosis outbreaks, public health is always, measles outbreaks, public health has always been there to try to mitigate the risk to the community and try to ensure that everyone has the opportunity to optimal health. So when this pandemic hit, Houston is such a resilient city, and we had been through a lot, frankly, coming back from Hurricane Harvey and the petrochemical fires 2 years ago, and then now to this pandemic, it has taken its toll on our community. And so some of the challenges that we have is that we have one of the highest uninsured populations in the country. Texas is the highest uninsured population in the entire country. And how do we help keep people healthy in the midst of a disease when we know they don't have access to healthcare? So that is one of the challenges that we face all the time, but that it got exacerbated during the pandemic. But also you started to see as economically communities were challenged, and as were businesses, we started to see that there was large gaps of populations that exacerbated health disparities. So that means that those communities that were the most vulnerable already to a lot of chronic conditions, this only spiraled and exacerbated their conditions. So the challenges that we have are reaching those populations to ensure, because we are an interconnected community. Everybody has a role to help each other be healthy. If we have one person sick, it's the ability to, especially with COVID, to spread to other communities. And so communicating a science, an evolving science, when we didn't have a lot of information and the science changes so rapidly, and then we have a vaccine, has been absolute a challenge with a very diverse population, but also trying to reach the most vulnerable in the community.
Our next speaker, Mohammed Wawala, is CEO of DM Clinical Research and the Texas Center for Drug Development. He has a different perspective as he's been on the front lines of the research and the development of the vaccines. He's going to talk a little bit about communicating during Houston Fights COVID, the campaign, and also what it's like to be a part of Operation Warp Speed. Mohammed?
Thank you, Christine. First of all, thank you for having me on this esteemed panel. Appreciate that very much. DM Clinical Research and Texas Center for Drug Development have been in business for more than 15 years. And as one of the largest clinical trial centers in the state of Texas, it was our responsibility to be of service to whatever we could during this pandemic. And since last March, we realized that we will have to play a role. We immediately had to pivot to figuring out what is the best way to communicate and educate the citizens of Houston. And we really leveraged our existing relationships in our communities, and really magnified and accelerated the relationships to have a greater spread and reach in the Houston community. Some of the challenges we had, like Elizabeth put very nicely, was timeline. I mean, we just had no time to really we had to make an immediate impact. The other thing we had was, we had to do several messagings in different languages to different types of messages and different languages. So in order for us to really cater to the diverse population and cater to our diverse communities here. We had to create websites, we had to create messaging, content in English language, in Spanish. We made sure we have staff that was also diverse so that people feel comfortable in approaching them. So multiple avenues which we can go into detail, but it has certainly been an honor to be on this panel, and we'd like to certainly share more and ask, delve into any questions that you all may have later.
Vanessa is Director of External Communications for St. Luke's Health. She's going to give us some insight as to working on the front lines, where she has experience and exposure to both patients and providers from the early days of the pandemic to now that we're seeing the vaccine rollout.
Thank you, Christine, and thank you so much, everyone, for making time to join us today from Canada and other parts of the world. So like Christine said, I currently oversee the external communications function for St. Luke's Health. We are a major faith-based health system in Texas with facilities in Greater Houston, East Texas, and the Bryan College Station area. In my current role, I'm responsible for overseeing all external communications and making sure that all our external messages align with our goals and our values. Interestingly enough, I joined St. Luke's Health in August of 2019. So most of my tenure here has been dealing with the current public health crisis, which, as you know, for us in Houston began at around the March timeframe last year. Back when we knew very little about the disease, right, and how it spread and how to treat it and how to protect ourselves and others. Because there was no published research about the disease at the time, our clinical leaders and experts didn't really have a playbook. So they had to rely on anecdotal evidence that they were hearing from their peers in other parts of the world, like China and Italy. An interesting fun fact, there was some type of a WhatsApp group that was created globally where physicians could actually exchange information and anecdotal information about what they were seeing and how they were having success treating and isolating patients at the time. From a communications perspective, we were faced with a challenge that we still very much see today, which is the ever-changing information and guidance, right, from the CDC and other national clinical associations. And I think Liz alluded to this earlier. The science changes a lot, right? And like I said, just a couple of minutes ago, because there wasn't published research at the time, and as more information became available, the CDC and other national associations kept changing their guidance and their recommendations. So that meant that for us working in a hospital setting, we had this responsibility to be very diligent in the way that we communicated changes about recommendations, both internally to our staff, our employees, our physicians, our nurses, but also to the community, to make sure that we were making our experts available whether it was for media interviews or for blogs or videos to inform and dispel myths, and to reassure the public that hospitals were prepared to respond to any type of emergency, including a public health crisis such as this one. I'll leave you with three main takeaways as a communicator working in healthcare during this time. Number one, your employees are your greatest assets. I think I'm in an external communications role, but my role has morphed quite a bit during the pandemic, and I have taken on a lot of internal communications responsibilities because regular communication with employees was key early in the pandemic, and it continues to be, just to make sure that we were keeping patients and staff safe, that we were educating them on the proper use of PPE so they knew when to use the PPE and how to use it effectively. And of course, to reassure them that there were proper protocols in place to ensure that their safety and well-being. Number two, the local media plays a very important role during a public health crisis. But it is very important to know that you have to strike the right balance, right, between giving the media too much access to a point where it compromises patient care, or the privacy of the patient, which for us is paramount in healthcare. We take HIPAA very seriously. So for us, that's one of our top priorities, is to protect the patient privacy, particularly during a time like this. And then third, I will say consistency in messaging is key. One thing that never changed for us during the pandemic was disagreeing with science, right? So all our communications reflected that, even when the science and the evidence kept changing as the pandemic progressed, our communications always reflected the fact that we made decisions based on science and scientific evidence. So that messaging was very much consistent throughout the pandemic. I look forward to answering any questions that you all may have later in the discussion.
Throughout this, we've seen a lot of frequently asked questions that seem to recur again and again, and also some myths out there. So what I'd like to do next is I'm going to read a myth, and I'm going to ask one of our panelists to sort of bust it down for us. So the first is, I've already had COVID and developed antibodies. I don't need a vaccine.
So the science, this is one of those scientific mishaps, is that it is true, the science says that you have some antibodies, but what is not definitive is how long those antibodies last. So though the science is still evolving, there is some evidence that shows you do build up some antibodies, but there's not enough evidence to say that it is going to keep you safe at a whole time frame, and that it's going to provide you enough protection for the rest of your life. And I think that's some of the misconceptions you have, the vaccine. And plus we also have, the science is evolving a lot around these what we call variants, right? So viruses mutate, and that's normally what they do in the world. So it's not a new thing, but we don't have enough science to say it's going to protect you from all these variants. So the best thing, what we do have is the science to say the vaccine is effective, it is safe, and does provide us some protection. And so we are going to err on that side, and we're going to use that science to ensure that everyone needs to get vaccinated, not only for yourself, for your loved ones, but for the broader community.
I think that's absolutely pertinent. We don't really have the virus is still new. If somebody has had antibodies either through COVID or some infection, even if they were asymptomatic, I think it's absolutely important to get the vaccine, because that is proven science. Unless the individual wants to wait years and years to see how, or months and months to see how the antibodies, decline over time, it's just safe if once they have access to the vaccine, to get the vaccine, because we know that's absolutely efficacious and works. And it's been tested over 40,000 patients, which is not a small amount. And now millions of people have gotten it.
Our next myth: everything has happened so fast with the vaccine trials and the testing. Couldn't this mean that data is compromised for the sake of speed?
I can talk for hours on this topic. The data has not been compromised. It just increased the speed, right? I mean, we talk about warp speed. I mean, it was really expeditious. However, The work we did was expeditious. It's the processes were still the same. The guidelines that were laid out by the FDA for any trial we had to still follow the same processes. So there were no shortcuts taken from any of the verticals in the entire development process. And to also note, the technology has been used in other infections before for years and years. So this was not a new technology. They just adapted this technology, took a chance, and they wanted to test if this works for COVID-19, and luckily it did, right? And so they took something that was already in process for other diseases, and they brought it to COVID-19, and it worked. So it's not like something just happened out of thin air. They developed like overnight. This was already in the works. They had the data, they had the science, and they just applied it to COVID-19. So certainly this is absolutely a myth, a misconception, fake news, if you will, that there were shortcuts taken on this. Absolutely no shortcuts.
All right, our final myth, I can't wait to get the vaccine, then I can stop wearing a mask and I don't have to worry about social distancing anymore. Vanessa, will you take this one?
Yeah, sure. So yes, the vaccine will offer protection to the vaccinated person, and it is effective, like my fellow panelists have discussed and alluded to, but you can still spread the virus to others. Not only that, the two approved vaccines have a 95% efficacy, which means it's not 100%. So at the time being, it is important to continue to wear a mask, wash your hands often, and stay at least 6 feet away from others. And we've done it for a year now. So I think having to do it for a little longer for the common good and to keep ourselves safe and our loved ones, it's the right thing to do.
Christine, I think it's important to point out that even after you get the vaccine, you don't build up your system. It's not really effective in the body until several weeks after. So people have the assumption, and then right now we have 2 doses. So people think they get the first dose and I'm vaccinated and I'm good to go. And the reality is you need that second one. And then several weeks after that, your body starts to acclimate and build into it. So, but in addition to that, you also have this idea of what we call herd immunity, right? So you still have a large amount of population who are not vaccinated. And so everybody has a role to play, and everybody has to do their part to keep each other safe.
So I'm going to ask a few questions specifically addressed to our panelists that do come up frequently and are kind of geared towards their area of expertise. Elizabeth, you did touch a little bit about this on your intro and just working with the different groups in Houston. We know Houston is such a diverse city. But obviously the messaging for every demographic can be difficult and challenging. From a communications aspect, how did you tackle that, and what have you learned as a result of it?
Great question. Very complicated one. So I think what we know is, for one, I think it's really important that you have a very diverse team that you can pull from. I think because you need to understand people's lived experiences and I think people's lived experience and diversity adds it adds a lot to your system. So for instance, I have someone on my team who is a Chinese national. And so when this first COVID started hitting the community, it was really insightful to have somebody give us that perspective of, well, when we started talking about quarantine, and obviously here in the US, our quarantine guidelines are very different than like somewhere in mainland China. And so part of understanding, and she starts to lay out, well, people don't understand that you just can't tell people to stay home and they can't leave, because over here we could do that. So then it starts to give you a good perspective of, hey, okay, so how do I reach this group, and how do I relay that information to this subgroup of this community? So I think one is diversity of your staff and understanding lived experiences plays a large role, especially when you're trying to reach a very diverse community. I think there's something that we call, it's called class, but it's really cultural and linguistically appropriate messaging. So understanding that you can't Google translate something and have people understand what you're trying to say. You have to be able to message something in a way that people can understand. And especially when we're talking about, either medical or very scientific terminology in a very simplistic way, so when people see it the first time, they understand it. So I think there's been a lot through our health education teams and through our communicators understanding how do you take this very complicated science and whittle it down so everybody can understand it. So I think those are some of the lenses that we came into it. Also working with, we have a lot of great partnerships through our faith-based organizations, through our community, community-based organizations. And so working with them to make sure that we're getting, hey, tell me, we're doing a lot of social listening. So tell me what you're hearing in your community. Tell me, is there something that you need? How can we address that? So we have a lot of so-called like ears, throughout the community to kind of make sure that we're allowing that feedback to come back and forth. There's a two-way in communication. But I think one of the most important things, and I'm really proud of, is we learned very early on is communication, especially from a government entity, is just not enough. And so what we've done is we have a huge amount, we call them promotoras and community health workers here, and they have been boots on the ground in the community educating people. And so they go to flea markets, they go to supermarkets, they go to schools, they go to football games, they go to all kinds of events. They go to, some of the, in Chinatown, they go to the grocery stores there. And so we had a very broad team, because I know that even though we do a lot with communicating to different groups, and we can do that through media and social media and advertisement and billboards and all that other stuff, sometimes it takes somebody who understands the community and is from the community to deliver that message. And so what we've done is that type of team, we've equipped very early on and trained them to answer a lot of COVID information, to be able to augment our services. And so they have for months been actually in the community, providing that information, and they've given out over 300,000 masks. They've reached close to 800,000 people. And so I think it's a multi-pronged approach that we work through partners. We're in the community, we're visible, we're doing the traditional communications and social media. So it's got to be a multi-pronged approach, and ensuring everything is culturally and linguistically appropriate, making sure that the information we put out is vetted by that targeted community to ensure that it is going to meet the needs of them. And so we put that all together, and that's kind of how the system that we've developed to try to educate the community about whether it be COVID testing, quarantine, or vaccinations.
Mohammed, I know the clinics have dealt with this too, and just reaching the different demographics in Houston. With Houston's diversity and what you got, the panels are all talking about what you've learned. Do you think this can be applied, some of the lessons learned, to the global rollout of the vaccine because of Houston's diversity?
I think absolutely it can. The diversity that we saw, we're a very diverse community here, from Asians, Hispanics, African Americans, Caucasians, and then a wide variety of different types of demographics. I absolutely feel that this could be used for the clinical trials recruitment or enrollment that we've done could be taken as an example and by the healthcare, public health, different entities across the globe to see what we did. I mean, we had to overcome a lot of barriers. I mean, clinical trials, for number one, it's just nobody knows about clinical trials, and if they know, they have the guinea pig concept of it. They don't know how safe it is. I mean, it's more safe than you going to a physician because there's 3 levels of oversight. So overcoming the barriers of clinical trial perception, branding what we're trying to do, because there was so much misinformation and confusing information, let me put it that way, that people were confused, they were anxious. And then you had to lay out and educate them. So I think education at the level, I think Elizabeth just pointed this out, it's not a one-cut solution, right? So you have to just use various approaches. You have to make sure you're talking that language. Google Translate doesn't work. We actually had, several of our family members or workers' family members, like who were not really involved in research at all, like layman approach to see if our translations really work, right? So our website, where all our messaging was in dual languages, English and Spanish. So yeah, I absolutely feel that there's a full case study of how this was done in such an expeditious way to be used for the global rollout as well. Absolutely.
And Vanessa, I know you're tasked with that too, with the diversity, but also you have patients and you have providers, so you have to also communicate differently to them. What have you learned from your experiences?
Yeah, no, absolutely. One of the most recent experiences that I've had reaching, our very diverse community in Houston was with the rollout of our vaccine hub at Texas Southern University. And this is a different nuance in that it wasn't so much the language barrier or a translation or a transcreation, but a lot of the folks in that community, especially the super seniors, 70 and older, don't have access to a computer or the internet, right? So us having to go out of our way to go to them with that information, partnering with local churches, assisted living facilities to make sure that we were physically bringing that information to them and providing assistance to help them register on site, rather than having to leave it up to them to scramble to find a daughter or a grandson who can help them log into the computer and get on our waiting list. So yes, so when we talk about diversity and the complexity of our community in Houston and many other communities across the country and the world, you have to think about all those nuances, right? Access, language barriers, and I think right now we're in a phase with the vaccine rollout where super seniors are the top priority. So reaching them in the ways, in effective ways, is extremely important.
Also, Vanessa, as the vaccine is rolled out, we know that that's kind of made headlines, but we can't forget that there are still people in the ICU. How have you sort of moved that narrative forward with the vaccines rolling out, but yet not forgetting as far as, external relations about, the patients that are fighting COVID still?
Yeah, it's interesting because I can't believe we've been dealing with this for a year. And we're coming on the 1-year anniversary of the first COVID case in Texas, which was March 4th. And I actually know this because that patient was a patient of ours in one of our facilities. So at the time, a year ago, there was a lot of chatter and a lot of misinformation and a lot of confusion around this concept of ICU capacity. I don't think anyone really cared prior to COVID whether or not our hospitals were full, right? Or if they got sick, whether or not there'll be a bed waiting for them at the hospital. But that obviously and rightfully became a concern for many people in our community, particularly after reading the headlines of what was happening in China and Italy and other parts of the world. So it became a priority for us at the time to educate the public and the media on what ICU capacity means. And unfortunately, it's not just a percentage and it's not a straightforward concept, but it's one that takes some explaining to do, right? Because every hospital has what we call a surge capacity, which means it's just their ability to add additional beds, ICU or non-ICU, and to expand physical capacity. So when you hear hospitals in Houston are at 100% capacity, that didn't really factor in the surge capacity. So we weren't really full. It just meant that our base capacity was at capacity. So it took definitely some educating, some explanation, some communication, some website, social content. So at the time, it has evolved, right? The communication needs throughout the pandemic have evolved. And at the time, that was definitely something that we had to address. Now we've moved towards the light at the end of the tunnel, and now we're focusing on educating the community about the vaccine safety, the efficacy of it, the vaccine distribution plans, which quite honestly, it's something that it's done by the state, not by the hospital. So I'm still actually having to educate the media sometimes on the fact that the vaccine distribution guidelines are not set forth by hospitals, but by the state. So it's been an interesting journey, to say the least, from the communications perspective.
Mohammed, I think it's safe to say that at least for Americans, if you would go back a year and a half, what they might have known about clinical research or vaccine trials was very little. And I think most people have read at least probably a couple of articles about it. Do you believe that, the pandemic has raised exposure in general of vaccine trials, clinical research, and that may be a positive, for you and those in your line of work moving forward beyond COVID for other vaccines for all diseases and public health?
Yes, Christine, that's absolutely correct. We actually are, we want to really take this to the next level in clinical trials, because this has really given us a lot of exposure about the great work that science does behind the scenes for every Tylenol that comes out, right? And for every headache and every arthritis and cancer and, vaccines in this case. So this has certainly given us that exposure, and we really plan to, educate and be very, very transparent. I think that's the two things that, we have done it for the last several years, and we're going to continue doing that, is educating the community on clinical trials and build on what we've already gotten because of this pandemic, and be, very transparent as to, I think that's what the population is looking for, is just, tell us really how it is, and go with that. We're still looking for volunteers for our vaccine trials, and the fight still isn't over. I mean, we still need a lot more vaccines out there to cover the entire globe. But I absolutely feel that there's the understanding and the level of knowledge has certainly increased. Absolutely.
Taking off from that question, from a public health standpoint, even things like washing our hands and sanitation, again, has COVID increased everyone's awareness? And is that going to be a positive, for your communication efforts moving forward? Because we know, unfortunately, there will be other public health outbreaks.
Yeah, that's so interesting. You never, until COVID happened, you really didn't think that people knew how to correctly wash their hands, right? And so you started it. You're absolutely right. It started to bring in some of the most basic levels of hygiene, of like people really starting to pay attention to it, because hand washing, besides COVID, is one of the for flu, right? It's one of the first lines of a defense. Make sure your hands are clean, because you touch your face, you touch other things. So yeah, I think that it has highlighted a lot of things. I think people did not pay attention to how much alcohol content was in their hand sanitizer before this. And now people are really paying attention. And so they're like, oh, well, this only has 30% of alcohol and it doesn't have enough. So I think in some levels it has really helped. We're just hoping that those, we have been public health been talking about hand washing for decades, right? And even inside healthcare. So I think hopefully this is one of those things that sticks for the long term.
Haley has been monitoring our questions, so we definitely want to get to your questions that you have. Haley, do you have a couple questions from our audience that you want to present to our panel?
We do have some really good questions that have come in. So we'll start with one here. Dr. Fauci has been quoted as saying, I think that scientists need to communicate. The field of science needs to communicate with the general public, because the ultimate goal of science is to do good, to gain knowledge, to understand and discover things that are ultimately for the good of mankind. So with science and healthcare often communicating complex terms and ideas, how do you simplify the message to ensure that it has a broader reach and understanding?
I'm smiling because that's part of my job, right? Is to not only dilute complex messages, but also coach our, in this case, physicians and nurses and infectious disease experts, coach them on how to put things in layman terms and how to talk to media and how to make things in a way that the person on the other side of the screen watching the newscast or reading the paper understands what they're saying. So that takes someone like myself and Elizabeth to help them, guide them. Physicians and scientists are just wired differently, right? And they're super smart. Not like the rest of us are not, but they just tend to explain things in very technical terms. So that's part of what a communications professional is tasked with. Just coach their senior leaders, CEOs, and in this case, physicians and nurses and doctors. And And I'll say that has always been a priority from early in the pandemic, mid-pandemic, when we had the second surge in June, July. But when the vaccine came out, when the news of the Pfizer and the Moderna vaccine getting approval by the FDA, when that came out, it became that much more important, because when you have to communicate vaccine confidence, it's different if I go on camera and I tell you that the vaccine is safe, but when you have the chief of critical care who has been in the ICU for months, right, fighting COVID and helping his team treat and isolate patients, when you have someone like that going on camera and explaining why the vaccine is safe, when you have that individual be the first or second in line to get the vaccine back when we got the first shipment in mid-December, that speaks louder than words, right? The fact that your chief top physician at your critical care unit was among the first to get vaccinated. So yes, absolutely. Layman terms and actions speak louder than words.
Yeah, I think that, come from us, because we were involved in initially the testing, the epidemiology, the data. And I think some of Vanessa, actually, she's absolutely right. It's a balancing act. And I think that sometimes what it takes is what I do, and I do that here, is, when they get really fixated on data, I'm like, okay, nobody cares about this. This is what's important. This is what people need to know. Like all these little, when you talk, there's a lot of it, you have to unwrap the academic piece from it to understand what is the broader community need to know and what is going to keep them safe. And I think that's something that we work really hard on doing. And that's why for us, everything that comes out from, whether it be data, whether it be, we have a lens on it, because it doesn't do, if nobody understands it, right, what good is it for the community? And so you have to make sure that you are dissecting that again, this goes back to the plain language. Anybody who reads it, whether they have a PhD or whether they have a fifth grade reading level, when they read that, can they understand that the first time they read it? And if you answer is no, well, then you got to go back and make it so it's simplified. And so I think that's one of the things that's really important around this topic. But I think some of the challenges going into it is that there's a science literacy issue in this country, right? So when you hear a lot of the misinformation around RNA is going to change your DNA, you're like, well, not really. Those are two different, DNA and RNA are two different things. I think you have to keep that in mind, because there is a science literacy issue. And so you have to make sure that everything is done in a way that people understand.
Christina, I'd just like to quickly add, so in clinical trials, we have the way we start, anybody, a participant or volunteer, start a trial with any study, be it vaccine or medicine, they have to read and sign an informed consent. And informed consent is basically a description or narrative of the entire trial, and it's in 5th to 7th grade study. So if an even child who's in the 5th grader, or an adult who's got an English or native language level of a 5th grader can also understand it. So that's the requirement in our clinical trials work. So absolutely, I agree that it should be very layman, so that the idea is that it's for the people, so the people need to be able to understand it.
I think Mohammed mentioned this earlier. I'll just share a quick anecdote. We had developed an animated video not long ago about how the virus spreads, right? And how super spreader events happen. And I looked at it and it was so confusing. Like at the end of it, I had a headache. I'm like, whoa, this is just too much information. But then I'm like, maybe I'm not being objective. So I sent it to my husband and I said, what do you think? He's like, wow, that's a lot. And I took nothing away from it. And that feedback was so important, because we took that packed video with packed information and we simplified it so much more. And it just became like exactly what we needed, right? So point being, sometimes you have to bring in folks who are outside of your field of expertise to be a little bit more objective and, accessible.
Absolutely. And Haley, I think we have a question sort of related to bias too, right?
We sure do. Yeah, that leads right into this question. So the question is, do you ever feel your own biases and experiences impact the message? And if so, how do you overcome these instances?
It's very relevant to us. Absolutely correct. That we put our biases, and terminologies and nuances and all of that stuff. And then, what we have and what a lot of the organizations have is a patient-centric team. Okay. They're not techies. They're not subject matter experts in the clinical trials work, for example, for us, but they're very patient-centric. They're just layman community members who we go poll and then you say, look, read this content. And does this make sense? Sometimes we reach out to kids because we do, adolescent trials and kids pediatric trials as well. So unless we do these focus groups or something, we have a resource like, Vanessa, you reached out to your husband, someone who may not be a healthcare professional. So we tackle this all the time, Christine, where we have a patient-centric team, and we will listen to them. We will not overrule them. They're pretty much our bosses, if you will, because we really take their feedback to heart.
This goes back to understanding is the social listening, right? And I don't know I guess you just have to be objective into understanding whether you're biased is a bad thing, right? So for instance, the example I used, I had someone who was from mainland China, right? There were certain biases that she had in information, but that helped me learn, okay, so what do I need to do differently in this circumstance? And what do I need to do to try to reach this group? And so I think that you have to just be mindful of it. But I always, I think that the number one job of a communicator is listening, right? And so even if you have a bias, your job is to listen, and you listen through whatever feedback you're getting through, for us, it's through our outreach workers who are telling me that this is what they're hearing on the ground. It's the feedback I get on social media. It's the calls that I get from the community, right? It's constant listening that helps keep that into check, or actually informs the way that you approach something.
I'm a former journalist, and you know this, Christine, and we're taught from the very beginning to be objective. So in my personal opinion, I always kind of put my journalist hat with every situation that I counter, because you have to treat situations objective, and you are human and you will have bias. But I think for the context of what we do, objectiveness is very important.
All right, let's go back to Haley. The next question, Haley.
So the question is, have you found any particularly useful messaging points for broadly talking about the benefits of clinical trials, given hesitancy or lack of understanding about what these are among the general public?
So great question, and we talk about this pretty much every day. I think trust is a huge factor. Being able to connect with the audience, in this case, the participants, the communities, is absolutely huge. So you've got to be able to create that trust with your messaging. And we really have a lot of diversity. For example, we have a lot of diversity even in our physicians that we have. We call them investigators, principal investigators, and anywhere from ranging from African American to Asian to Hispanic ethnicity. And when people can relate to their own type, I think that just overcomes barriers. I mean, I think it's really important. One of the things we found is to create that trust. How do you create trust in that messaging? And I think that's a central theme of any people trust physicians and doctors, their own doctors. And another thing we've done is we had done focus groups and educational groups with physician communities, so to educate them so that they can then educate the trusted patients. I think trust goes a long way in the messaging, and somehow you can create that trust. It really it can go a long way. The benefits of clinical trial, and there is hesitancy there. Unfortunately, the media in the past has highlighted a lot of, I think it has not been forgiving to the clinical trial community, let me put it that way. This time it really, clinical trial clinical researchers have come to the front line and really gone above and beyond. I mean, our staff, our physicians have worked above and beyond several hours and hours, 7 days a week straight to just make things happen, because we just couldn't, there were no shortcuts, right? We had to follow the processes, but we just had to do a lot more work in a short amount of time. So I think the benefits of clinical trial in terms of what a participant gets out of it has really come to, I mean, you get a lot of the volunteers, they get a lot of oversight. I mean, they get a lot of, they get involved in their care. They know more about their medical conditions. They just get more oversight. They know more about their illness or their disease process. I think it's really beautiful what has whenever there's participant, about the statistics are showing that about 90% of patients that do participate in a clinical trial, they want to participate in another one. So I think the national news, all of that, the press, I mean, obviously we're in a pandemic and the vaccine is, is a news story every day. That has really helped outline the benefits of clinical trials.
All right. Hopefully we can maybe get to 2 more questions. Haley, do you have the next one?
So technical question first. In regards to the 2-part vaccine, what are the risks of effectiveness for people that weren't able to get the second dose as scheduled? Some had their appointments canceled and other complications arise.
So right now, based on the CDC guidance, there's not enough evidence to say that 1 dose they're still trying to study to say whether 1 dose is enough. So that's why right now the current science saying you need 2 doses. But CDC has also said that you can, depending on your vaccine, you can get, for instance, Moderna up to day 42. Now, what happens, you don't need to get it exactly on day 28. But what happens outside of on day 50? Right now, the guidance says get it as soon as possible. So even though you were not able to get the vaccine, I wouldn't, if you're still within that even day 42, I would encourage you to register to get it. You don't have to get it on day 28. You can get it up to 4 days early. This is for Moderna. But even if you are on day 50, the guidance says right now to get it as soon as you can. If you're not able to get technically speaking, though, it's preferred to stick with the same vaccine. If you have an option to get, if you needed to get another vaccine, whether you started with Moderna and the only option is to get the Pfizer, CDC does say you can go ahead and do that, though it's not highly recommended. They are saying that you can go ahead and do that. But what I would just say is it's okay if you didn't reach day 28, you can still get it. And I would just encourage you to get scheduled as soon as you can to get it, because right now that's what the guidance is from the CDC.
Okay, hopefully we can get to one last question, Haley.
What lessons learned from a strategic communications perspective would you highlight from your individual experiences right now communicating during this pandemic? What lessons learned could you apply to any industry? So as our audience is very much of a broad communications field, what are your lessons learned that you'd pass on?
So many of them, right? So that it's kind of hard to pick 1 or 2. But one of the things that could possibly transfer to other industries is for us in the very beginning of the pandemic, being aligned with our county health officials was very important. I think I mentioned earlier that we had the very first case of COVID in Texas at one of our hospitals in Fort Wayne County. And at that time, having that connection early on with the PIO for that agency was very important. Aligning on how much information was to be shared, ensuring that we're protecting the privacy of that patient, and ensuring that we were protecting our staff as well. So I think that transfers to any industry, because I think when you are in a responding to a crisis, whether you're a petrochemical company or you're an airline, aligning with those agencies that are tasked with working closely with, it's extremely important. So that's probably one of the ones that I would say.
I think the first thing is have a very quick understanding for whatever for one, we have a plan. We always have a plan, right? We have a plan for everything. So we have a plan that I know that if we go into whether it be Zika, whether it be petrochemical. I know the strengths of my team, and I know where I slot them in if I have to get into an emergency, right? So I think it's having a plan, have a plan of your audience, know the strength that you have for whatever topic it may be. So you have to brainstorm, whether it be a petrochemical, who's going to be your spokesperson for that. So we do a lot of prep. There's a lot of media training that's done beforehand. There's a lot of prep for people in case I have to pull them up. So I would know who your spokespeople are going to be. And then make sure you have a risk and a crisis communications plan.
I think my biggest thing always is understand your audience. Like Elizabeth said, you've got to be able to understand how are they going to receive your messaging, and then you cater your messaging according to the audience. I mean, we can all talk all day, but if you want to be effective, you've got to be able to understand your audience. And then, like I think Vanessa said or Elizabeth said, be a good listener. I think that's important. So you have a plan, you understand your audience, you have a plan, and then you kind of change your plans according to how you get feedback, right? So it's an evolving thing. You've got to be A/B testing, etc. So I think understanding your audience is my big one.
Well, I think we are about out of time. We do want to thank our panelists for this insight. I know we could talk all day on this, and I'm sure there are many more questions. Mohammed, Vanessa, Elizabeth, thank you so much for joining us.